First of all, we have Mr. Joel Allison, CEO of Baylor Scott and White Health. We have Dr. Toby Cosgrove, President and CEO of Cleveland Clinic. Dr. Joseph Cashone, cardiologist and Chairman of Operations and Strategy at Cleveland Clinic's Heart and Vascular Institute. And Dr. Michael Mack, Baylor Scott and White Health Medical Director of Cardiovascular Services and Chair of the Baylor Scott and White Health Cardiovascular Governance Council. I'll turn it over to Mr. Allison. We'll start.
Thank you, Nikki, and good morning. Welcome, everyone. We want to, on behalf of the Baylor Scott and White Health Board of Trustees, welcome each and every one of you here today for this very historic moment in the life of Baylor Scott and White Health. And this is an exciting day for us. We are extremely honored today, and Dr. Toby Cosgrove, as you heard, was introduced, and then Dr. Cashone that you'll be hearing from later, and of course our own Dr. Michael Mack. So it's a real honor to be on the stage with them. These are all the experts. I'm just here to make sure nobody leaves the stage too early. But it is indeed a great honor for us to have you with us today and to talk about this wonderful alliance that's been created between these two great organizations. Before we get started, I'd like to recognize some other special guests that we have with us today that I believe are in the audience. Of course, our own city councilman, Sheffy Kadane. Sheffy, stand up. Thank you for being here. We appreciate the support that we get from our city council, and he represents this campus. Did the mayor of Plano?
They're en route.
They're en route. We will also expecting the mayor of Plano, and also the mayor pro tem is going to be here as well because of our location with the Heart Hospital Baylor Plano. Very supportive of that institution. I also want to say thank you to the board members. We have several board members here, board members from Baylor Scott and White Health Holdings. We have board members from Baylor University Medical Center, the Jack and Jane Hamilton Heart and Vascular Hospital, and also the Heart Hospital Baylor Plano. So with all the board members from all those, would you stand so we can say thank you, because we appreciate your leadership. Our purpose today is, Nikki said, was really to announce this new alliance. It's the one between our three Baylor Scott and White Health hospitals that you just heard mentioned, and then of course the Cleveland Clinic's Heart and Vascular Institute. I'm going to keep my remarks very short so that you can hear from the experts, Dr. Cosgrove, Dr. Cashone, and Dr. Mack, to talk more about this alliance. But I would just hasten to say that this is more than, to us, I think, more than just an alliance. It's really about where we think the future of healthcare is going. It's around a collaborative agreement, and we believe collaboration is the way to the future. And the reason for the collaboration is because our two wonderful organizations are really focused on how do we make it better for the patient. How do we improve patient care? And the opportunities that we have with this collaboration to share best practices among our clinicians, to look at research and innovation on cardiovascular care, really is going to make it better at the end of the day for the patient. And that's why we're all here, is to do everything we can to provide high-level, quality, safe care. And I think no one is better at doing that, obviously, in cardiovascular services than Cleveland Clinic. They are recognized as the leader, and the fact that they would choose us as a network partner because of how they believe we deliver high-quality care. And we've been on this journey, as you know, for 2 decades to constantly look at improving quality of care, outcomes, making it better for the patients in all different service lines, but particularly today, focusing on cardiovascular. And again, Toby, it's an honor to be in your presence and have you with us, and I want to turn it over to you.
All right. Thank you very much, Joel, and thank you for being here. It's a pleasure to be here. You know, I think that this is a type of alliance that is going to become the pattern for healthcare across the country. Essentially, it's teamwork, and it's bringing together great organizations to try to improve the quality of care for the patients. And I see that we got 2 organizations, both of which are outstanding in the field of cardiovascular surgery and cardiovascular medicine, and they're coming together for sharing their strengths and making each other still better. Cleveland Clinic is interesting in the fact that it has been the place where it was the origin of coronary angiography, coronary bypass surgery. It's been leader in heart failure for some time. Similarly, we've seen enormous capabilities coming out of this organization. We like the fact that this organization is very similar to ours in the fact that they stress quality, innovation, teamwork, and service. And I think the two organizations fit very well together and are poised to begin to make cardiac care even better for both organizations. I think that the reason that we're doing this is only one reason, and that's for patients. Our mantra at the Cleveland Clinic is patients first. It is the guiding force for everything we do. We think that this sort of alliance begins to help patients across the country and in both of our organizations. So finally, let me just say how appreciative I am to Joel and all the people here at this organization who have made this organization and this alliance work over time. We clearly has come together with a lot of thought and teams from both organizations, so I'm appreciative of that. And then let me turn it over to Dr. Joe Chavone, who's chairman of our operations and strategy for Cleveland Clinic Heart and Vascular Institute. Joe.
Thanks, Toby. You know, when we looked around the country as we looked to create a network of like-minded hospitals across the country, when we looked at Texas, we looked at Baylor and the Baylor Dallas as the natural partner for us. The culture, what we found here when we came is a commitment to quality and a culture that's very similar to what we have in Cleveland, and that is that commitment to get better every day. And that commitment, as both Mr. Allison and Dr. Cosgrove mentioned, is really about the patient. And what we found is that cultural commitment here is as strong as it is in Cleveland. So we saw this as a natural fit. We do think that there are aspects of this relationship going forward that we haven't even discovered yet that will make us both better. And I couldn't think of a better partner in Texas. We couldn't think of a better way to make the care for people in Dallas better, and for the people in Cleveland and all those people that touch our individual hospitals. Michael and I have had a personal relationship that's developed over the last few years, and it's made it even more natural for us to sit down and think about and blue sky where we could take a relationship like this. And we're very excited about, I'm personally very excited about working with Michael and the team here, and I think the whole team at Cleveland is very excited about what this opportunity affords both organizations. So thank you, and I'll turn it over to my friend and colleague, Dr. Mack.
Well, thanks, Joe. This is only the third time in the last 10 days we've seen each other, so. So first of all, I would like to welcome Toby and Joe and the whole Cleveland Clinic team that's here that came down this morning. To make you feel at home, we imported some Cleveland weather. So you can feel like you can feel like you never left Cleveland. So unaccustomed as I am to public speaking, I do have a couple of prepared comments that I would like to share. So first of all, I think this affiliation between Baylor, Scott & White, and the Cleveland Clinic is a big deal. I know everybody goes into the next way of doing things thinking it's a big deal, but make no mistake about it. This is a huge deal in the way that healthcare is going to be delivered in the United States. And while today is the formal announcement, in reality, this is the culmination of a 20 years close working relationship between our two institutions, which has been based upon mutual respect and academic collaboration. We have multiple physicians and administrators that are here in the room today that work with Baylor Scott & White Health. Mark Valentine in the front row, Gonzo and his whole team in the back of the room, that were all worked or trained at the Cleveland Clinic. So our cultures and our goals are already closely intertwined. From a personal standpoint, I've been an unabashed fan of the Cleveland Clinic for my whole career. I don't know if Toby remembers, but I actually called you 20 years ago and said, is there a way we can work together? So everything in life is timing, and 20 years later, here we is. So, you know, one of the reasons for that is the Cleveland Clinic has always been recognized as a premier center for cardiovascular care, not only in the United States, but worldwide. They've been on the cover of U.S. News and World Report for 24 straight years, and it's not an accident they're there. They're there for a reason, simply because they really are the best. And it's a privilege for us to be able to have this alliance and work with them going forward. Now, this alliance was contingent upon Baylor Scott & White being able to deliver Cleveland Clinic quality care here in North Texas. And in order to ascertain this, the Cleveland Clinic team, which is here with us today, undertook a very ambitious due diligence process of looking through every aspect of cardiovascular care that we give, not only in our three hospitals, Baylor University Medical Center, Jack and Jane Hamilton, and Baylor Plano, but throughout the healthcare system. And their findings were that they were confident that we could deliver Cleveland Clinic quality care here in North Texas. And although we were pleased with that finding, we weren't surprised. We knew that, but we were very happy that from the outside, it was self-evident. Now, there are many measures of quality care in the United States, but from a heart surgery standpoint, undoubtedly is the Society of Thoracic Surgeons 3-star rating. There are 1,150 cardiac surgery programs in the United States. They are ranked in 3 categories of heart surgery, and the top rating is a 3-star rating. There's only 14 programs in the United States that were ranked 3 stars in all 3 categories, and 2 of them were the Cleveland Clinic and Baylor Scott & White. So I think that is self-evident. At the end of the day, this is all about quality partners and creating a quality network throughout the United States. So the question is that I've received multiple times locally, well, why are we doing this? Baylor Scott & White has a great reputation. Why do we need the Cleveland Clinic? And I think the answer to that became evident as the Cleveland Clinic team spent days with us in terms of looking at us. And the finding was, from their standpoint, we're the best kept secret in the United States. So from my point of view, we don't want to remain a secret. I think this affiliation will allow us to expand our reputation to the next level and develop an international and national presence similar to what the Cleveland Clinic has now. I think this is truly an instance in which the whole is greater than the sum of its parts. This national network is totally different from anything that has preceded it. Everybody says they deliver quality, but the Cleveland Clinic National Network is a brand new paradigm in healthcare delivery, totally different from anything that's preceded it. It's about establishing a national network of the highest quality care available for all. Baylor Scott & White Health is centrally located in the United States with 2 great airports, making it very accessible, and will be a key and integral part of making the Cleveland Clinic Network truly a national success. From a Baylor Scott & White standpoint, we are truly proud of the health care we deliver, and now our affiliation with the Cleveland Clinic Heart and Vascular Institute will make us even better. So again, I congratulate everybody on the year that is taken to make this alliance happen, and we look for nothing but great things going forward. Yeah. Yes, sir.
What does this mean for patients here in Dallas? What will be different for them? Yeah.
Mike, you want to take that question?
So we always thought that we did a good job, and the process of going through this with the Cleveland Clinic allows us to shine a mirror or hold a mirror up to ourselves. And we find that, as good as we thought we were doing, the Cleveland Clinic still did things a little bit better. And already we've incorporated a lot of the processes that they do. It's been a bi-directional learning experience, but I think we're better already just from having the alliance that we're doing right now. So our first thing is that our patients are going to get better care as a result of this. Secondly, I think that this will create even more of a destination for patients to go to than previously known, similar to what Cleveland is. Thirdly, over the last 5 or 6 years, as our name and as our reputation has grown, we've been able to attract higher quality physicians and surgeons to the Dallas area and to the Baylor Scott and White health system. That will only continue to expand as our reputation grows, and this significantly will help our profile and allow us to attract the highest quality care providers going forward.
Other questions? Anyone?
Well, sorry, the mechanics. A patient here needs to come here. How will the partnership help that particular patient? The mechanics of, will they go to Cleveland? What is the
So no, there really is. So there are no physicians from Cleveland that are going to be here. The patients aren't coming from Dallas to Cleveland. This is about collaboration around quality process. It's about collaboration around clinical scenarios that may come up. So if a patient comes to Baylor Scott and White and Dr. Mack wants to talk to one of the surgeons in Cleveland about that patient, they have the immediate availability to talk to one of those surgeons. And so it really just creates a bigger pool of experts, both here in Dallas and in Cleveland, that are available to confer on individual patients, whether they be in Dallas or whether they be in Cleveland or whether they be in one of our other network sites. We really have created a network of high-performing providers to allow better care and to raise the bar of care all across the country, both here in Dallas and in other network facilities. And we're using the things that Toby and everybody have established in Cleveland for over the last 35 or 40 years and that have made Cleveland Clinic the #1 heart hospital. We use that history and that scope and that knowledge to help raise the bar of care for everyone.
Question? Chef?
I'm not a doctor, so this is probably a dumb question. Are there new and different procedures we're learning from Cleveland Clinic that we're bringing here?
So the question was, for those in the back, are there new and different procedures that are performed at the Cleveland Clinic that we now are able to do here? And I think that the answer to that is that we have already had a long-term relationship, that we worked very closely together on multiple new procedures and multiple new research trials. There's a new device in the United States to replace heart valves without surgery by threading them up through an artery in the leg. The Cleveland Clinic and ourselves were two of the centers in the United States that started that procedure in 2006. So I think that, as I said before, this is not a new beginning in a way, but it's a culmination of and a formalization of a close working relationship that's going to take us to an even better level. We have had discussions and interactions on multiple different levels from the Cleveland Clinic, from heart surgery to cardiology to electrophysiology to research. We just 2 weeks ago had a prolonged conference, teleconference on research possibilities. There's a premier research center at the Cleveland Clinic, and our center, collaborating with them, is going to bring even more new cutting-edge procedures and medications to this as a result of this alliance.
Yeah, let me just add, if I could, on top of that, one of the advantages we have is we have a tremendous volume of patients. For example, over 4,000 heart operations. As you do more and more, you see more nuances in how you deal with those that other people don't have a chance to see because they just don't see that variety and that volume. It teaches you how to look after things that are rare and to share that. And I think that the Alliance allows us to share that experience in a very major way that works around the edges of looking after very difficult situations.
And leading up to that, would this lead to us opening clinics elsewhere for this purpose?
So, Joe, maybe you want to give some idea of what the national network plans are and?
Sure. Our plan is to have somewhere between 20 and 30 of these alliances, affiliations around the country that will, for the purposes of bringing high quality care to all around the country. So anything that we do in Texas or Oklahoma now will be in conjunction with Baylor Scott and White, so we would see that Baylor Scott and White would be the hub for any sort of expansion in Texas and Oklahoma, and we would use that. And then in other areas, we have other hospitals that will function as the hub in those areas. So it's exciting, it's growing fast, and there's a lot of interest nationally, and we'll add 3 more affiliates this year, in the first quarter of next year.
And I think to that point is what was said earlier. This is what I know Toby and I believe is the future of healthcare. It's these types of collaborative efforts. It's making sure that you continue to meet the mission that we have around patient care, medical education, research, because we can continue working together in this collaborative, share best practices, but also share that clinical material around the research that was mentioned that we now have that access. So when we look at what are the new techniques, the new innovations in cardiovascular care, you get the strength of the 2 organizations. Question back here? Yes, ma'am.
For the gentleman from the Cleveland Clinic, you're already the Cleveland Clinic. So what is in this for you? What's the advantage for you all in forming these alliances?
Well, for us, we're a national practice, and as Toby mentioned, we do over 4,000 open heart surgeries a year, and those open heart surgeries come from only less than half of them come from inside the state of Ohio, so they come from all over the country. And so we see our national practice continuing, and we think having relationships like here in Dallas and other places will afford us the ability to partner with the right hospitals and to be able to maintain relationships in these in regional care collaboratives. Much of healthcare is going regional, so if there's an accountable care organization that develops, is there an established relationship between Cleveland and Dallas that would make that seamless connection? So if a patient chooses to come to Cleveland for their surgery, not that they need to, but if they choose to come to Cleveland, there's a seamless connection between caregivers. And so we see this as, so that's the one thing that I think that we see is being able to maintain a national practice. The second thing is the larger and the bigger scope we get, and I know Toby can speak to this better than I, it's about the size and scope. It will make healthcare more affordable. We can lower implant costs. We can learn from one another. There's a whole host of cost efficiencies that come as you get larger. And so those are 2 areas that right off the bat that we think will make things better, and what Cleveland Clinic gets out of this.
So perhaps you'd be directing patients back to Baylor that may contact you from Texas to
Yes.
say, you can get this care close to home.
And that's exactly right. So, if an employer patient were to come to be triaged, so a patient lived in Dallas and came to us through one of our employer contracts, and they happened to live in Plano or they lived in Austin, and we'd say, you don't need to come to Cleveland for your surgery. You can get Dr. Mack to do your surgery, and that would be one of the ways that it would benefit Baylor Scott and White.
And as we've gone through that process, that has already happened already. They've dealt with us in very good faith and done exactly as Joe said. The other thing I would say is we now have the 2nd largest heart transplant program in the world here at Baylor. Last night the team did their 98th heart transplant this year. Cleveland Clinic has a very long waiting list that goes into years of patients waiting, and there have now been 5 patients from Cleveland that have been referred to Dallas for heart transplant. So that's another example of potential synergies that have been a byproduct of this relationship.
Other questions?
Is there a financial consideration in either direction for this relationship?
As far as the alliance, there was a agreement on a payment for that alliance, but that is the financial consideration. That's all.
So Baylor will be paying Cleveland Clinic?
We have a relationship with Cleveland Clinic and a financial relationship for the network. Correct. Oh, yes, ma'am.
One last one. I was curious, so I'm glad that you brought up healthcare costs. Do you think with better care, healthcare costs might be more savings? Would that not be true?
No, let me handle that if I could. First of all, I think that if you look at healthcare across the country, healthcare has been a cottage industry. And in every other industry in the United States has come together for efficiency, quality, and cost. And I think that's what you see happening right now in healthcare. Healthcare is consolidating all over the country, and they're coming together, frankly, from financial pressures. And this collaboration gives us an opportunity to begin to use our purchasing power jointly to decrease the cost of healthcare across our organizations.
And if I could add to that, you know, the basis of this is all about quality. And good quality really does translate to better cost. So the most expensive thing in healthcare is complications. And if we can provide quality certainty, then we can provide some degree of cost certainty. So I think that is another major way in which I think we can control healthcare costs.
We've run out of time as we bring this to a close. Let me just say again, thank you all for being here. And I also want to say a special thank you to Dr. Cosgrove and Dr. Cashone and their team from Cleveland Clinic. I also want to thank our team from Baylor Scott and White Health and the 3 hospitals that will be a part of this alliance. Thank the teams, our clinicians, our staff for working on this so diligently to really do what has been said by, I think, everybody on this panel. At the end of the day, it's all about making it better for the patient. There's no other reason to do it. It's all about improving quality. It's improving how we deliver the care. It's being innovative. And ultimately, as Dr. Cosgrove says, we all believe good, quality, safe care reduces the cost. And that makes it better for the patient and the communities we serve. So thank you all, and thank you again for being with us today.